What if I told you that one of the most trusted exercises for building strong legs might actually be making your body less stable after the age of 50? For decades, the fitness world has told us the same thing. If you want strong hips and a strong backside, you must do squats. They tell you to go low, to go heavy, and to push through the pain. And to be fair, squats are not bad. They are not the enemy. But here is the question almost no one asks. What if the way most people over 50 are doing squats is no longer serving their body the way they think it is? As we cross the age of 50, our bodies begin to signal a change. You might feel a little stiffness in your knees when you wake up. You might notice that your balance isn't quite what it used to be when you're walking on uneven grass or stepping off a curb. This is because traditional squats are a linear movement. They move you up and down in a straight line. But life, Shekilbai, does not move in a straight line. Real life is unpredictable. Real life happens when you trip on a rug, or when you have to turn quickly to catch a grandchild who is running toward the street. These moments require stability and lateral strength, not just raw power. If you are only doing squats, you are training for a gym, but you are not training for your life. The Science of Stability and Dr. Walter Willett. I work with older adults every day, and the research is very clear. A large review cited by Harvard Health shows that as we age, our joints lose their natural shock absorption. The cartilage wears thin, and the fluid that keeps our joints moving smoothly begins to decrease. Our nervous system also begins to slow down, meaning the signals from our brain to our muscles take just a fraction of a second longer to arrive. But the most important discovery comes from Dr. Walter Willett at Harvard University. His extensive research into longevity and physical health shows that hip stability is much more important than raw leg strength when it comes to living a long, independent life. In fact, the CDC reports that falls are the leading cause of injury-related deaths for adults over 65. But here is the surprise that many people miss. It is not muscle weakness alone that predicts a fall. It is instability. It is about how well your hips and your brain can work together to keep you upright when you move sideways or backward. If you only train the big muscles like your quads with squats, you are building a heavy house on a very weak foundation. You are ignoring the small stabilizers that actually protect your spine and your joints. Today we are going to fix that foundation using smarter, scientifically backed movements. Community engagement. Before we dive into these 4 life-changing movements, I want to invite you to join our growing community. This video is not just about exercise, it is about taking back your independence. Please take a second right now to go to the comments section. Write your first name, your age, and the city or country you are watching from. We have viewers from all over the world, from the busy streets of London to the quiet suburbs of Australia. Knowing who you are helps us stay connected and motivated. We read every single comment because we care about your journey. Let us move forward together toward a stronger, more confident version of yourself. Exercise number 4, Side-Lying Hip Abduction, the protector. Let us start with a movement that looks almost too simple to be effective. When you first see the Side-Lying Hip Abduction, you might think it belongs in a beginner's class. But do not let its simplicity fool you. This is a total game changer for anyone over 50. This move targets a specific muscle called the gluteus medius. The gluteus medius is the small muscle located on the outer side of your hip. In the world of physical therapy, we call this the master stabilizer. Why is it so important? Because every single time you take a step, this muscle has to fire. When you lift your left foot to walk, the gluteus medius on your right side must contract to keep your pelvis level. If this muscle is weak, your hip drops, your spine leans to one side, and your gait becomes wobbly. Over time, this leads to chronic lower back pain and knee strain. Dr. Walter Willett emphasizes that waking up this muscle is the absolute first step to becoming fall-proof. Most people who do squats never activate this muscle properly. Their big thigh muscles take over, and the stabilizer stays asleep. How to perform this correctly for maximum benefit? Find a comfortable place to lie down. A firm yoga mat or a carpeted floor is best. Do not do this on a soft mattress, as it will not provide the support your spine needs. Lie on your side and rest your head on your arm. Bend your bottom leg at the knee to provide a steady base of support. Now, extend your top leg perfectly straight. Here is the secret detail that makes all the difference. Do not point your toes toward the ceiling. Instead, point your top toe slightly downward toward the floor, as if you are trying to touch the ground with your big toe first. This tiny rotation ensures that the work is happening in the hip stabilizer and not in your hip flexors. Slowly, and I mean very slowly, lift your leg upward about 12 to 15 inches. Do not swing it. Use pure muscle control. Pause at the top for a count of 2. Now, lower it down even slower than you lifted it. The down phase is where the most strength is built. Imagine there is a heavy weight you're resisting as you lower your leg. You should feel a gentle, deep burn on the very side of your hip. This is not a sharp pain, it is the feeling of a muscle waking up. Perform 15 slow, controlled repetitions on each side. If you can only do 5 at first, that is perfectly fine. Quality is always better than quantity. Exercise number 3, posterior hip abduction, the rotational guard. Now we move to exercise number 3. At first glance, this might look exactly like the move we just did. But by changing the angle of your leg by just a few inches, we target a completely different layer of your hip anatomy. Why do we need this? Because real-life accidents rarely happen when we are moving perfectly straight. Think about it. Most falls happen when you are turning around to look over your shoulder, or when you are stepping backward to get out of someone's way, or when you are pivoting to get out of a car. These are rotational movements. Standard squats and leg presses only train you to move forward and back. They do not prepare your hips to handle a sudden twist or a side slip. This is why many people who are gym strong still struggle with balance in the real world. Research published in Clinical Biomechanics has shown that adults who specifically train their hips at a backward angle have significantly better recovery when they are thrown off balance unexpectedly. Dr. Walter Willett and his team have noted that as we age, we lose our ability to control rotation. This exercise is the cure for that loss of control. How to do it with precision. Stay in that same side-lying position on your mat. However, instead of having your top leg directly in line with your body, I want you to slide it back about 4 or 5 inches so it is slightly behind your torso. Now change the foot position. Instead of pointing your toe down, rotate your entire leg so that your toes are pointing up toward the ceiling. This opens up the hip joint and engages the posterior fibers of the gluteus medius and the deep rotators. Slowly lift the leg toward the ceiling. You will notice that you cannot lift it as high in this position, and that is perfectly normal. The goal is not height. The goal is engagement. You will feel this deeper in the back part of your hip, near your gluteus maximus but higher up. Breathe in as you lift, and breathe out as you lower with full control. You are retraining your nervous system to catch you if you slip sideways. You are building a protective shield around your hip joint. Take your time. Do not rush the movement. Marcus speaks slowly here because this move requires intense focus. Perform 12 repetitions on each side. Exercise number 2, the standing hip drop, the walking miracle. We are now halfway through our journey. Exercise number 2 is one of my personal favorites for anyone who loves to stay active. Many of you tell me, Marcus, I walk for 30 minutes every day. Isn't that enough to keep my legs strong? Walking is a wonderful medicine. It is good for your heart, your lungs, and your mood. But walking is essentially a series of controlled falls. Every time you lift one foot off the ground to take a step, your body is momentarily unstable. For that split second, the hip muscles on your standing leg have to work incredibly hard to keep your pelvis from tilting over. If these muscles are weak, a chain reaction occurs. Your pelvis drops, your opposite knee caves in, and your lower back has to twist to compensate. This is why many people over 50 experience back pain after a long walk. They aren't walking with their glutes, they are walking with their spine. Traditional squats do not fix this because in a squat, both feet are on the ground. You never practice that single leg stability. The standing hip drop is designed to fix your walking mechanics from the ground up. The step-by-step instructions find a place where you have something sturdy to hold on to. A kitchen counter, a heavy table, or a wall is perfect. Stand tall with your feet hip-width apart. Shift all of your weight onto your right leg. This is now your standing leg. Lift your left foot just an inch or 2 off the ground. Now, very slowly, allow the left side of your hip, the side with the hovering foot, to drop down toward the floor. You will feel your pelvis tilt to the side. Your right leg should stay straight. Do not bend the knee. Now, here is the magic part. Use the muscles on the side of your right hip to pull your pelvis back up until it is perfectly level again. It is a very subtle, small motion. You might only move 2 or 3 inches, but this small motion is exactly what keeps you steady when you are climbing stairs or walking on an uneven sidewalk. Dr. Walter Willett has noted in his longevity papers that balance drills like this can reduce the risk of hip fractures by more than 40% because they improve your proprioception, which is your brain's ability to know where your body is in space. Perform 10 slow repetitions on each leg. Focus on the feeling of your hip pulling your body back into alignment. You are telling your brain, I'm in control of my balance. Exercise number 1. Standing hip extension with rotation, the ultimate secret. We have finally reached a number 1 exercise. This is the movement that almost everyone gets wrong, and honestly, it is not your fault. It looks so ordinary that most people just brush it off as a simple stretch. They think, I'm just swinging my leg back, how can that be better than a heavy squat? But here is the hard truth that science has revealed. Life is 3-dimensional. You don't just move up and down. You pivot in the kitchen to grab a plate. You reach into the back seat of your car to grab a grocery bag. You step backward out of an elevator. If your deep hip stabilizers and your spinal muscles are not trained to handle these rotational forces together, that is when the body breaks down. That is when a simple move results in a pulled muscle or a sudden fall. According to a recent study in the journal Gait and Posture, older adults who practiced controlled hip extension with rotation improved their reaction time to instability by 36%. This move connects your brain, your core, and your hips into one solid unit. How to do it correctly? Stand sideways next to a wall or a sturdy chair. Hold on for balance. Shift your weight onto your inside leg. Move your outside leg slightly behind your body, keeping the knee straight. Now rotate your foot so your toes point away from your body at a 45-degree angle. This is the external rotation part. While holding that rotation, gently swing your leg back just 4 or 5 inches. As you swing your leg back, allow your upper body and your chest to rotate slightly in the same direction. Pause for a moment. Then return to the starting position very slowly. Do not fling your leg, do not use momentum. This is about quiet, controlled strength. You are teaching your body how to recover from the exact movements that cause real-life accidents. You are building what I call functional armor. By practicing this move, you are ensuring that your body can handle the twists and turns of everyday life without pain or fear. Aim for 10 repetitions on each side twice a week. Final safety advice and medical disclaimer before we conclude today's session. I must share a very important message regarding your health. While these exercises are designed to be safe and effective for adults over 50, they are for educational purposes only. They are not a substitute for professional medical advice, diagnosis, or physical therapy. Every person's body is unique. You may be recovering from a previous surgery, managing a chronic condition like arthritis, or dealing with specific joint pain. Therefore, it is absolutely essential that you consult with your doctor or a licensed healthcare provider before beginning any new exercise routine. Your safety is the true foundation of your strength. We do not want you to rush. We do not want you to push through sharp pain. If a movement feels wrong, stop immediately and speak with your doctor. Modern medicine is a miracle, but prevention through smart movement is even better. Listen to your body, respect its limits, and grow stronger at your own pace. Conclusion: a new way of moving. We have covered a lot of ground today. We have looked at why the traditional squat might not be the best choice for everyone over 50. We have explored the groundbreaking research of Dr. Walter Willett and the importance of hip stability over raw power. But most importantly, you have learned 4 movements that respect the wisdom of your aging body. After 50, you do not need to prove anything to anyone in a gym. You do not need to lift the heaviest weights or do the most difficult workouts. What you need is movement that supports your independence. You need strength that allows you to climb stairs with ease. You need balance that lets you walk on a sandy beach or a rocky path with total confidence. You need a body that you can trust to support you every single day. Strength is not found in a mirror. It is found in your ability to live your life without fear of falling or getting hurt. Start where you are today. If you can only do one of these exercises, do that one. If you can only do 3 repetitions, do those 3. Because what feels like a small step today will be the very thing that keeps you standing tall 10, 20, or 30 years from now. I want to thank you for spending this time with me. It is an honor to be part of your health journey. Please, if this video helped you, give it a like and share with a friend or a family member who needs to hear this message. And don't forget to subscribe so you never miss our guidance on how to stay strong and healthy as you age. I am Marcus, and I am so proud of the progress you are making. Keep moving, keep learning, and I will see you in the next video. Stay strong and stay safe.